sit down. What seems to be the problem, Mr. Ash?
My wife and I already have 4 beautiful children with a 1-year gap, but we are afraid that we can fulfill their needs. I think it's time for us to consider doing contraceptive procedure such as sterilization. I would like to ask for your opinion on this.
This is a big decision to make. Why don't you and Mrs. Ash try other contraceptive methods such as condoms or pills? And have you discussed these things with Mrs. Ash?
Yes, I already discussed it with my wife and we agreed to proceed with this procedure. Also, we already tried other contraceptive methods, but unfortunately my wife and I have some allergic reaction while on it.
Oh, I see. If both of you already agree in ongoing the procedure, then it should be no problem. But before continuing with the documentation part, do you know what it means by sterilization?
No, doctor. Can you please explain?
Sterilization is any procedure that makes a person incapable of reproducing. On male, usually we do a castration or vasectomy procedure. Castration is the surgical removal or destruction of both testicles, while vasectomy is a procedure in which a small portion of the vas deferens is surgically removed. This stops sperms from entering the urethra, but it has no effect on the amount of semen produced by the body. So both of these procedures have side effects. Here, I suggest you read this pamphlet and discuss it with your wife. If you have any question, you can simply message me.
Sure, doctor.
Hello, Mr. Anisha. I need you to give your semen sample in the container, okay?
I'm sorry, but why do the doctor need it?
Oh, the sample will be used for sperm count, also known as sperm analysis. It is examination for newly ejaculated sperm to determine its amount, number, shape, size, and mobility. Since you just had the procedure, the test will show whether the vasectomy was successful.
I see. Thank you, nurse.
Excuse me, Dr. Hidayah, can I have a moment? I need to consult with you on something.
Sure. Go on, doctor.
So, doctor, a 36-year-old male patient came in with a complaint of the presence of blood in his semen. He also claims that he's been married about 12 years and still doesn't have a child. During palpation on his left testis, the patient complained of slight pain.
Presence of blood in the seminal fluids means that this patient has hematospermia. This condition can be caused by infection of the seminal vesicle. You should do the sperm count.
Doctor, I already sent this specimen to the lab and the lab noted that he had oligospermia. Can you remind me what oligospermia means? Seems like I already forget.
Oligospermia is defined as a sperm count of less than 20 million per milliliter. It is also known as low sperm count and is a common cause of male infertility. Also, another term you might want to familiarize in this department is azoospermia, which means the absence of sperm in the semen. And one more thing, you should teach him testicular self-examination.
Alright, doctor, I'm going right away. Alright, sir, here is your drug prescription. And before you leave, I want to teach you testicular self-examination.
What is testicular self-examinations and why should I do it?
Okay, sir. Testicular self-examination helps detect lumps, swelling, or changes in the skin of the scrotum as a self-help step in the early detection of testicular cancer. Testicular cancer is the 9th and 10th most frequent cancers in males in Malaysia. However, this cancer is highly treatable when diagnosed early. So don't worry, that's why you should learn how to do it.
I understand now. Thanks, doctor.
You're just in time. There's only 30 minutes left until the end of visiting hour.
We got here as soon as we could. How are you today?
I feel better. Thanks for coming.
Hey, you look good. What did the doctor say?
He said it was a severe operation, but I don't have to worry about it because they are great doctor and very professional.
That's great. I'm sure they will take good care of you.
Can I know what the surgery is about?
Yes, the doctor said that I have an ovarian cyst and ectopic pregnancy.
I'm sorry to hear that, but what did that mean?
Ovarian cyst is a rupture of an ovary, and an ectopic pregnancy is a pregnancy that happens outside of the uterus.
Hey, we're in this together. We're with you. Take your time and rest. And I hope that you have a speedy recovery.
Yeah, we are here to help you. If you need anything, you are in great hands. So, you don't have to worry and be strong. Our thoughts and prayers are with you.
Thank you, guys.
Did you guys know that my auntie Farah just got back from the hospital?
No. What is wrong with your auntie?
First, when she has an annual gynecological examinations, she says has no conditions of menometorrhagia. She has cervical dysplasia and colpopexy surgery.
What is menometorrhagia?
Menorrhagia is an excessive uterine bleeding occurring both during the menses and at irregular intervals between periods.
What was cervical dysplasia and colpopexy surgery?
Cervical dysplasia is the presence of precancerous changes in the cells that make up the inner lining of the cervix, and colpopexy surgery is the surgical fixations of a prolapsed vagina to a surrounding structure.
Poor Aunt Farah. How is she now?
She is getting better. She is strong and she gets through it. She is primipara and she doesn't have galactorrhea.
Getting surgery is hard, but I'm glad that Aunt Farah is doing well. Send our regards and also best wishes and hopes for a speedy recovery to Aunt Farah.
I will. Thank you guys. I think we have to leave. Ainil, you need to rest and we will visit next times. Bye.
Oh, yes. All right. Thank you for coming. Bye. Hey, honey. Are you coming back from the hospital? What did the doctor say?
Doctor said that I may suffer from anovulation.
Anovulation? What did that mean, my dear?
It happens when the egg from the ovum does not release from the ovary during the menstrual cycle.
Is it really experienced by a person? I never heard it before.
Yes, Mom. The doctor said that anovulation is a common condition and is the cause of approximately 25% of infertility cases. It can be said that only 1 in 10 people with ovaries who are of childbearing age experience anovulation at some point in their life.
Yes, that's true. The doctor also said that the one of the symptoms is having irregular periods, and it is the thing that happens to Daya.
Can you tell me what are the causes of these issues?
Doctor said it is because of the high level of androgens, or it can be called as hyperandrogenism.
Hyperandrogenism. What it's mean by the excessive presence of the male sex hormones like testosterone, androsterone, and androstenedione in women, and the effects that they have on female body, right?
Yes, Dad. Wow, you know the meaning of the term? I'm about to do some research about the meaning, but thanks to you, Dad, for the explanation.
I have heard about that too. A high level of androgens can cause these follicles to stay small instead of enlarging and maturing like they are supposed to before ovulation.
That is true, but Mom and Dad, you don't have to worry about this matter that happens to me, okay? It can be treated with some treatment.
So, what is this treatment that can be done?
Change the lifestyle. Doctor said that Daya is obesity, so she has to manage her weight.
If that's so you have to try to lose weight, my dear, to treat your anovulations.
Make sure that you refer to any registered dietitian to make sure it works for you. You don't have to worry, okay? We will always support you.
Yes, I will try to lose weight so that I will recover from this. I will do my best.